of the risks, how to manage, and most importantly, to adopt preventive measures for a healthy heart and a happy life. While the inaugural session will take place at 10:30, we will commence with the introductory and technical sessions. Our first speaker for the day is Dr. Anand Agarwal, Head of Department, Cardiothoracic and Vascular Surgery, Sri Madhusudan Sai Institute of Medical Sciences and Research. With over 3 decades of experience in cardiology and cardiothoracic surgery, he worked in various government and corporate hospitals in Hyderabad and other places. He will share with us the journey of Save the Young Heart, a campaign that he conceptualized and remains passionately committed to. Dr. Agarwal, please.
Om Shri Sai Ram, with my humble pranams at the lotus feet of Sadguru Sri Madhusudan Sai, welcoming all the faculty, delegates, and my dear students. So, Save the Young Heart. Can I have the slides, please? I came back from UK in 2009. Then, when I started operating in India, I was seeing that I'm operating on patients younger than me. Next slide, please. And these patients who I'm operating on actually are the lucky few. Because what we are seeing in the young adults is they are not even able to reach the hospital doorsteps. You must be hearing people dying in the gym, people who have died on their wedding day, people who are actually, while exercising, so many things. So I started pondering, what is the reason? Then I was seeing in my own practice that when I operate, actually I am a bypass surgeon. I do coronary artery bypass surgery. So I am a glorified plumber. I take one artery from the chest and one artery from the hand or leg, and I see of these young adults. So you can imagine the fate of the graft which I give, because there is no lumen in the artery to graft. There was a study done here near Bangalore in Jayadeva Hospital in 2019, where they have seen people from 19 years onward who are admitting to the hospital with very severe heart attack. And, my colleagues and all will elucidate all the classical risk factors for coronary artery disease. But what they have shown is, apart from the standard risk factors, factors like pollution, factors like vehicular traffic is also a major cause of heart disease. Because what they found is that the cab drivers are also at an increased risk. So I'll give you a little bit of gyan here. Our heart is a bag of muscles. It beats 72 times a minute. Do you know any engine which beats 1.2 lakhs times a day? And we are not having any external power of supply to that organ. It's the engine of our heart. If our heart stops beating for 3 minutes, we are going to have a CPR session later on tomorrow, and I urge all of you to attend. If the heart stops beating for 10 minutes and 3 minutes, and if we do not revive that heart in 3 minutes by whatever emergency measures we take, that patient is brain dead. So first of all, we all need to understand our body. Okay, so the heart is a bag of muscle, and it is supplied, because it is a muscle, all the parts of our body are supplied by arteries. So the heart is also supplied by 3 arteries. One is the main artery, which divides into the left anterior and obtuse on the left side, and the right artery. So the whole game of heart attack is because of blockages in these heart arteries. How does it happen? My colleagues will tell you all the risk factors. Because of the risk factors, lipid is deposited on the intima of the vessels. I will tell you something more about this. I want you all to understand very clearly because it goes a long way in understanding our body mechanics. The inner lining of the heart arteries is lined by something called endothelium. And that endothelium is also lining all the other hollow viscuses in our body and also all the arteries in the veins. If I were to scrape the endothelium from all the vessels, and if I were to put it in a bucket, the weight of that will be more than the weight of the liver. And this endothelium is a very, very sensitive structure. Leave alone the classical risk factors, what we are speaking. Any emotional outburst, any heightened state of awareness or whatever, it causes inflammation in our body and in the endothelium. You must have heard many people, even anecdotes have been, somebody is watching India versus Pakistan match semi-finals, India loses and he dies. Why? Because this endothelium is it's a very, very sensitive organ. I would say, I will take a senior cardiologist are sitting in front of me, I will dare to say endothelium is an organ because it is lining all the heart arteries. Okay? So if you were to ask me which is the best textbook of medicine, I would say Bhagavad Gita is the best textbook of medicine. All our students have chanted Bhagavad Gita for a year. We had Bhagavad Gita Jnana Yagna here. So the most important shloka is, I will not be telling in Sanskrit, but in pain and sorrow you remain equanimous. So when you remain equanimous in pain and sorrow, joys and pleasure and everything, that endothelium, you are keeping it pristine. And if that endothelium gets damages, you will get all those blockages. So let me elucidate some of the risk factors, diabetes, hypertension, cholesterol, everything is the thing. But stress, and most important thing is subconscious stress, which is playing a major role. If I go and ask my friend, how are you? Oh, perfectly fine, he'll say. But if you just probe a little bit, you will understand what emotions are piled up. So subconscious stress is playing a major role in nowadays young adults. Another thing which I will say, you might be wondering why this cardiac surgeon is speaking like that, but this is the fact of life. A young adult, buy now, pay later policy, and suddenly AI outbursts, he loses the job. Sudden financial pressures. All this leads to stress. Another thing, late night. We are very, very lucky here in ashram that we sleep on time and get up on time. But outside, many teenagers, they are not sleeping before 1 o'clock. There is an age-old adage, early to bed, early to rise make a person healthy, wealthy. First is healthy. You understand, this is a major, major cause. Later on, Dr. Sushil Sharma is also going to elucidate tomorrow. Lack of sleep is a major, major thing which is, because 10 o'clock to 12 o'clock is a time when melatonin is secreted in our body, and that causes relaxation. See, even if I have the topmost car, Bentley or Mercedes, we cannot keep on driving, no? So my body is like a car. It has to take rest. And we might be physically resting, but our mind keeps on going. Okay? And late night dinners. There has to be a gap of at least 3 hours before your dinner and time you sleep. I'm telling you, small, consistent changes is what is important. So what can we do? See, we have summarized our whole concept of Save the Young Heart in 2 things. One is ahar, second is vihar. Ahar is what I take through all my panchendriyas, and vihar is how I recreate. That's it. There is nothing more to it. This system, whatever you eat, it becomes a part of you. I eat a banana, by afternoon that banana is part of me. So we have to be very conscious, not even through the mouth. Whatever we are seeing through our eyes or hearing through our ears, everything amounts to food for our body and mind. Mind you, it's a very, very subtle thing. See, we are touching so many topics in 2 days. So each point is, I think one of the other speakers will, put to it. early morning waking, I'm telling you, with exposure to sunlight is the most important thing. Apart from vitamin D, there are so many other factors known and unknown we don't know how sunlight helps us, because we are part of nature. How we relate to nature? Our bodies. We are not in silos. I am as much of a part of nature as everybody else. So this is very, very important. And most important thing, what I feel, which is leading to today's early heart attack, is our lack of joint family system. We have become a nuclear family, husband, wife working, no time to chit chat and have a free time with the family. It's very, very important. Where previous days we used to have once everybody come, eat together, relax together, talk together, that's a de-stressing mechanism. So once you get blockages, you come to us, my cardiologist will do a stent or will do a bypass surgery. That is not what the Save the Young Heart stands for. I have many of our supporters from Hyderabad. We started this journey later. I'll tell you more during the inauguration time. But we want to prevent young adults coming to our doorsteps. Also, young adults don't succumbing. So what we have done so far is from 2017, we have organized some runs in Hyderabad. After COVID, we could not do it. So now, what is the thing? The next action is, from awareness, we have to go to action. So on our website, we'll be later on today evening doing a heart risk assessment. I urge all of you to be there. So by filling that inter-heart risk score-based assessment, we can predict whether somebody is at low risk, moderate, or high risk. So that will give us an indication on whom to intervene. So because of paucity of time, I think we'll take up the questions during the break. You can reach out to us. Anyway, I'm a part of Ashramite here. Thank you for your patient listening.
The next speaker is Dr. Anand Kulkarni, retired professor, Department of Preventive and Community Medicine. A dynamic public health expert, he has held leadership roles in various academic bodies, shaping public health in India and Saudi Arabia. Dr. Kulkarni will speak to us on the global burden of premature coronary artery disease.
Thank you. Naham karta harih karta tat puja karma chakhilam tathapi matkrita puja tat prasadena nanyatha. Apada mauli paryantam gurunam akritim smaret tena vignah pranashyanti siddhyanti cha manorthaha. At the outset, let me offer my humble pranams at the lotus feet of our Divine Master, Sadguru Sri Madhusudan Sai. Today, I am supposed to be talking about global burden. I have slightly modified the topic, understanding premature coronary artery disease. In that, we will also include the global burden. What is coronary artery disease? Anand has already explained. Okay, the arteries that are supplying the heart get blocked because of the plaque development. It is like the mother cooking food for the entire family, but she herself doesn't get the food because she serves everybody selflessly, and at the end she is getting very less food every day. That's what heart is doing. Heart is supplying selflessly the blood to every organ in the body, but sometimes it doesn't get blood for itself. That is, in short, coronary artery disease. So definition of a coronary artery disease, according to the modern science, is coronary artery disease is a condition where the arteries supplying the blood to the heart muscle become narrow or blocked due to building of plaques. This is the definition. For me, it is a psychosomatic and lifestyle disease. So modern medicine focuses on the blocks, removing the blocks. That is palliative. That is symptomatic treatment. What is the root cause? That we have to understand, and only then, if we want to prevent if we want to control, if we want to reduce the effect of this pandemic, we will be able to be successful. Now this is the picture which shows that coronary arteries normal and blocked coronary arteries. What is premature coronary artery disease? Premature coronary artery disease is the currently defined as occurrence of the first clinical manifestation in women more than 60 years or less than 60 years, and in men less than 55 years. This is the current definition. But what we are seeing is the global burden of the disease study has reported that among the young, coronary artery disease is one of the important causes of morbidity and mortality, especially in developing countries. In India, the largest number of young heart attacks are occurring in the whole world. So why this is happening? What is the problem? What is to be done to prevent this? This is what we have to understand. Now, if you want to see the risk factors, Dr. Anand has already explained, obesity is considered to be one of the important risk factors. So if you see what is the obesity, 46% of adults are either overweight or obese. 46% of the total population, you remember. Okay? So that's one of the important diseases. Why people are becoming obese? We have a lot of people seeking help to reduce the weight, but they are not able to reduce the weight. People advise, okay, eat less or do exercise. Whatever we do, some people are not able to reduce their weight. What is the problem? Why they are not able to? Okay, what is the pathology? Where is the root cause? So that we have to understand. See, if you see here, the obesity and obesity in children, okay, 28% of the children. Okay, forget about adults, because it is starting in children. Even coronary artery disease, the block starts at the age of 5 years, and sometimes even in the children less than 5 years also we have seen starting the blocks. So that means the lifestyle is the problem. What is the lifestyle that we have to change? That we will see little later. Now if you see here nutritional status of adults, if you see again in the women who have got a waist. Now, waist circumference is more important in body mass index. That is, the weight, the obesity that you see on standing on the weighing machine is less important than your belt size. Just take a tape, and that's more important. The fat deposition in the abdomen and visceral organs, particularly in the liver, is more harmful than fat anywhere else. Subcutaneous fat is inert. It is not causing any problem. Now, prevalence of abdominal obesity was found to be 40% in women and 12%. Now for women, please remember, it is more common in you, so you people have to take little more care. The finding shows that 5 or 6 out of 10 women between the ages of 30 to 49 are abdominally obese in our country. The association of abdominal obesity in women is stronger with older age, urban residents, wealthier sections, and non-vegetarians. I am not saying this, this is science is saying. So vegetarian diet is definitely better to reduce the risk of obesity. For these practicing, those practicing Sikh religion, it is more for some reason because of their diet. Abdominal obesity is also on the rise in the rural areas and is penetrating lower and middle socioeconomic groups. That means it is pervading all the groups in our country. Now if you see the adolescents 10 to 14 years, overweight or obese 5.3%, and adolescents 15 to 19 years 4.3%. Total if you see it is 4.8%. Now deaths due to obesity, coronary heart disease is the largest number of deaths due to obesity in our country. So it is not only having morbidity, but it is also having mortality. Now you see another risk factor is diabetes or high blood sugar. Now blood sugar, 13.5% of people have got high blood sugar in women, and 15.6% of men have got high blood sugar. This is the Government of India NFHS 5 data. So this is not any private survey. The Government of India's data shows that blood sugar is important risk factor, and it is becoming very common in our country. Okay, again, so these are some of the important risk factors. For lack of time, I will rush through quickly. All these are indicating that the risk factors in our country are increasing. But what are those risk factors? Now nutrition, hormones, and lifestyle choices. These, according to 3, are three more important things which we have to focus. Nutrition plays 80%, okay, of the role is played by nutrition. All other things, including your exercise, sleep, and other things, 20%. So if your diet is correct, medicine is not needed. If your diet is not correct, medicine is not effective. So therefore, diet is very important. Lifestyle includes so many things we will be discussing during the course of these 2 days. The gut microbiome is another important thing which is generally neglected or overlooked. We have to understand that when we are eating, we are not eating only for ourselves. We are eating for the guest that is inside us. Trillions of microbes are there inside. You have to feed them, and fiber is the food that they require. And all the processed foods remove fiber for longevity of that food, shelf life. So processed food is in fact a slow poison. So anything that you have to tear and eat, that means you are tearing your heart. Please remember that. So do not eat or encourage children to eat processed food. Unfortunately, the marketing people of the processed food industry make it so tasty, so nice looking, and even so cheap, so that everybody is tempted to go for those processed foods. Now, hormones affect nearly everything in our body, particularly insulin. The effect of insulin we will be talking about during the course of these 2 days. So we have to understand that something inside is happening which is not visible to us. We have to change all these things. This insulin resistance is important. Yes. Insulin resistance is the root cause of almost all the metabolic symptoms, syndrome, and hypertension, diabetes, and coronary artery disease. The root cause is metabolic disease and insulin resistance. What are the causes of insulin resistance? 4 of them are in our diet: sugar, refined carbohydrates, processed foods, and vegetable seed oils. Vegetable seed oils are loaded with omega-6 fatty acids, and which are inflammatory, and therefore we have to understand that the advertisement says that this oil is better, this oil is better. So many oils are advertised. All vegetable seed oils are loaded with omega-6 fatty acids, and they are inflammatory. So these are some of the important risk factors for insulin resistance, and most of the non-communicable diseases root cause is insulin resistance. So we will be discussing these things in the course of our 3 days. I'll just skip this. I'll come to, again, these are some of the risk factors. I'm sorry, I'm going back. Okay. Now, our Dr. Anand said stress. What is the cause of stress? Why do we get stressed? According to me, Tyagat Shantir Anantaram. Bhagavad Gita says very clearly, Tyaga. We should be able to, give things that we have and forget that it is mine. Here I have said the visible risk factors and invisible risk factors. The invisible risk factors which are generally neglected are Kama, Krodha, Moha, Lobha, Mada, Matsara. These are the things. Because of this only we are having all the stress, and we are all running after money and position and what not. So because of this, if you are able to renounce these things, so that will be an important thing to reduce your risk for all these non-communicable diseases and improve your health. So inflammation and oxidative stress, these are scientific terms. These are also generally neglected by the medical profession. Now, this is an iceberg phenomena. What we see, the number of cases coming to the hospital and deaths are due to coronary artery disease are only few, but the submerged portion, if you see, the social causes, economic causes, behavioral causes, they are more important. So therefore, we have to tackle the root cause of coronary artery. These are the 8 essential things: nutrition, physical activity, blood sugar, weight, lipids, blood pressure, smoking and alcohol, and good sleep. So these are 8 essentials to have a good heart. Now I will come back to Anand has already said Bhagavad Gita is the best textbook. Yes, I 100% agree. And what Bhagavad Gita says, this is not Bhagavad Gita, this is a shloka from our ancestors. Vyayamat labhate swasthyam, dirghayushyam balam sukham, arogyam paramam bhagyam, swasthyam sarvartha sadhakam. That means exercise you should do, that is already said, lifestyle modification. So it's already there in our scriptures. Punarvittam punarmitram punarbharya punarmahi Etat sarvam punarlabhyam na shariram punah punaha. Okay, if you lose your money, friends, wife and kingdom, you can get them back. But this body, you will not get it again. That means you have to take care of your health. That's very important. Now coming to Bhagavad Gita, okay, food. What is the food that Bhagavad Gita recommends? See, there are so many foods recommended in the modern science, but what Bhagavad Gita says, Aharastvapi sarvasya trividho bhavati priyaha yajnastapastatha danam tesham bhedam imam shrunu. There are three types of foods, Satvika, Rajasika, Tamasika. Even the National Institute of Nutrition, ICMR, okay, institution, also suggests three types of foods, sedentary worker, moderate worker, heavy worker. Our Sattvic people are sedentary workers because they are reading the scriptures, the Vedas and Puranas and Bhagavad Gita and others, and they are teaching their pupil. So they are sitting and working. They are similar to sedentary workers. So that is what it says. So Ayush Sattva Balarogya Sukha Priti Vivardhanaha Rasyaha Snigdhaha Sthira Hrudya Ahara Satvika Priyaha. What the food does, they have said first. Okay, Ayuhu Sattva Bala Arogya Sukha Priti Vivardhanaha. All these things will increase if you eat sattvic food. What is sattvic food? Rasyaha Snigdhaha Sthira Hrudya. Okay, Rasyaha, Rasa Bharita Ahara. It's a common sense. Okay, anybody can tell me which is Rasa Bharita Ahara? Hannu Hampalu. Okay, vegetables and fruits. Now our National Institute of Nutrition has recognized now, and it is gradually coming to recommending more fruits and vegetables. When I was a young professional in 1990, they gave the first guideline, dietary guidelines for Indians, ICMR Institute, National Institute of Nutrition. What they said was, okay, 140 grams of vegetables was enough, fruits were not recommended at all. Okay, they have revised now and they have come to 400 grams of vegetables and 100 grams of fruits. That means 500 grams per day. Okay, how many of us are eating 500 grams of vegetables? Just ask ourselves. We are not eating anything. They have reduced carbohydrates. They had recommended 460 grams in 1990. They made in 2011 to 375, and currently they are recommending 270 grams. Even that is high according to us, but still, okay, they are, time is over. Okay, they are okay, coming back to what Bhagavad Gita is saying. Okay, so again, they have not only said that, Bhagavad Gita also says about the entire lifestyle. Natyashnatastu yogosti nachai kanta manashnataha nachati swapna shilasya jagrato naiva charjuna. That means the person who eats too much or too less, the person who sleeps too much or too less, the health will not be good for them. Okay, further they have said, yukta ahara viharasya yukta cheshtasya karmasu yukta swapnava bodhasya yogo bhavati dukkhaha. Yukta means, okay, you must have proper, okay, food, ahara, vihara, achara, vichara. You ನಾಲ್ಕು ಸರಿಯಾಗಿದ್ರೆ ನಮ್ಮ ಆರೋಗ್ಯ ಸರಿಯಾಗಿರ್ತದೆ. So some people say, what is this yukta, sir? We don't understand. You must specify. Like Anand says 370 grams, we understand. 270 grams, we understand. What is yukta? They have, okay, questioned several times. So here there is a the famous Chinese American, okay, doctor, scientist or angiogenesis expert, who is saying that, you must leave the party before it is over. That means you must not eat full. That's what he says. He recommends 80%. What our ancestors have said, only 75% you must fill. What is that? Annena purayet ardham udakena tu tritiyakam udarasya chaturthansham saurakshayet vayucharane. What they have said, you fill your stomach only half. Everybody knows what is our capacity. Okay, it is not same. 270 grams for everybody, absolutely not possible. One side doesn't fit all. Okay, so we have to tailor make our food. My size, I have to fill the stomach every time only half. 1/4 fill with water and 1/4 remain, keep it empty, vayu charane, like mixer. If you want to make a chutney, coconut and groundnut or something, you don't fill it to the brim. Okay, you fill half, put some water, and some place is empty, properly mixed. Our food has to be mixed properly with the digestive juices. Therefore, so that is the key message, and even yoga says, mitaharam vinayastu yogarambham tu karayet nana rogo bhavetasya kinchit yogo na siddhati. That means mita mattu hitavada ahara tagolbeku anta yoga kuda heltade. Now here there is a Ayurvedic proverb, when the diet is wrong, medicine is of no use. When the diet is correct, medicine of no need. That means diet is very, very important. Now because of lack of time, there are a lot of things, myths about cholesterol, so that we will not be able to cover now. We will be discussing in the course. I am available for discussion during breaks. So metabolic dysfunction in modern medicine. This is what again a famous American metabolic health expert, world famous expert, who has written a book which is the best-selling book in the world, that is called as Metabolical. He says modern medicine is not the solution to the problem, but the modern medicine is the problem. Okay? That is what is. Okay? Why? Because modern medicine is treating diabetes, hypertension and coronary artery disease as the symptomatic treatment. They are palliative treatment. They are not the causes. If you have hypertension, take medicine. My own example I will be talking about during inauguration. Okay, I was on medicines for 7 years. Now I am free of medicine for 1.5 years, and my blood pressure is much better than when I was taking medicine. So medicines are given for diabetes, hypertension, heart disease, everything. Okay, but that is not going to cure. That is not going to prevent. That is not going to reverse. But lifestyle definitely reverses all these problems. So Mount Abu open heart trial, one of the best done scientific research in India, in Mount Abu, Raja Yoga meditation has reversed 100% coronary artery disease, and this was published, and this is world record, the largest number of citations for largest duration of time, 3 years. Continuously, this was the largest number of citation for this article. That means this has got some value, and that is what we have to understand. So ultimately, why we are making this as integrated conference is because integrated medicine, not only the Western medicine, is required for healthy heart, happy mind and healthy body. Okay, thank you, and I will be taking questions during interval. Thank you.
We now have Dr. Deepak Saha, a senior consultant cardiologist and director of the cath lab at TX Hospitals, Hyderabad, with over 2 decades of excellence in interventional cardiology. He is renowned for his expertise in complex coronary angioplasty, device implantation, and structural heart interventions. Honored with multiple awards, including Dr. APJ Abdul Kalam Excellence Award, his patient-centric ethos blends cutting-edge care with compassion, and he will speak on the topic acute cardiac events.
Good morning, all. I have been given this topic. First of all, my sincere thanks to the institution as well as Dr. Anand Agarwal for inviting me for this talk. And since I represent the allopathic part of medicine, so I'll be speaking more on how the medical science has evolved and how the heart attack has been reduced with the treatment that we offer in today's world. But today I will be speaking more on what the cardiac events, how it happens, what are the symptoms, what are the risk factors, and how we can try to improve that. Next slide, please. So this is the common scenario. You must be seeing all over that persons, you can first line, you can see that person having a heart attack and he suddenly collapse. Sometimes in a gym, this is very common nowadays, this is a flavor. So anyone that is collapsing in a gym, that is first in the social media. And even if it is a celebrity like a sports person or a film actor, then obviously it will come more often in the social media. And even the sports person, in the last slide down, you can see that he's a Danish footballer who was a very good midfielder, and then he collapsed immediately during one of the important match. So no one is spared, but what I want to say is no one is spared because of this coronary artery disease. And the symptoms sometimes are very atypical. People ignore those symptoms. And sometimes what we see is people are found dead in the home. So these are the natural deaths. The patients are alone at home and suddenly next day morning they are found dead because, and the postmortem says that he had a massive heart attack at the night. So these sometimes are inevitable. We need to understand all these things, and we need to see how the lifestyle measures and medications we can do so to prevent heart attacks, especially in the young population. Thank you. So this has been already discussed, just how the heart attack happens. So this is basically, as in the heart is a bag of muscle which keeps on pumping all throughout our life. and every second it pumps, so it needs nutrition and oxygen supplies to it. And that is being supplied by 3 major coronary arteries that we have. And blockages of any of these coronary arteries, any of these arteries causes heart attack. This is again why heart attack happens, that in the left on column you can see there is an artery where there is a cholesterol deposit, what we called as a plaque, and it keeps on increasing as the age advances. It may start as early as adolescence, sometimes in the childhood, and it keeps on increasing. At some point of time, the plaque bursts and it invites blood clot, and suddenly there is an occlusion in the artery that leads to heart attack. So first and foremost, that we should understand that these plaques are very dangerous and we need to prevent it. And even if the plaques are there, can we regress it? And how even we don't allow this plaque to rupture and doesn't allow a clot formation. So there are various ways that we can prevent the heart attacks. Some are by lifestyle measures, others we give medicines for it, and some medicines have shown to be very effective in preventing all this heart attack. So who is at risk? So we know everyone is vulnerable to heart attacks. We know whether it's elderly, young females, everyone is vulnerable to heart attacks. But it has been shown that some people are definitely more prone for heart attacks. One is the hypertension, and it increases the risk of heart attack by 3 to 4 folds. Even if the patient is asymptomatic, patient does not have any symptoms, and he goes to a physician, he checks the blood pressure and the blood pressure is high, then his risk for developing a heart attack is increased by 3-fold. And the control of blood pressure itself, if the blood pressure is controlled, no matter what ways, we can use medicines, you may use lifestyle measures, but if you control your blood pressure, then you reduce your risk for heart attack by 20 to 25%. So I will be talking more about data that we have and how can we improve on those data. The next risk factor is diabetes, and definitely diabetes is a precursor to coronary artery disease. Whenever there is a diabetes, definitely this guy is going to have a heart attack sometimes in the future. And it has been shown that 90% of diabetes, they die because of the coronary artery disease. When and why is the question. So what are the risks? The risk of coronary artery disease, that is blockages in the heart, is increased 2 to 4 times as compared to person who doesn't have a diabetes. So diabetes itself is a major risk factor for coronary artery disease. And death due to heart attack is doubled. Suppose a patient who develop a heart attack, he is a diabetic, his chances of dying during the time of heart attack is 2 times than a person who is a non-diabetic and develops a heart attack. So diabetes not only causes blockages, but it also increases the severity of these blockages. So that is very important. So the chances of dying due to the heart attack is also doubled when the person having diabetes. And sudden death, a person who dies immediately after a heart attack, whether within a half an hour or 1 hour before he reaches the hospital, that is increased almost 300 times in women and 50% in men when the patient is a diabetic as compared to a non-diabetic. So these are very scary numbers that we understand, and then a lot of studies have been done in diabetes, whether it's a lifestyle measures, medications, but our own goal is that to prevent coronary artery disease and other cardiac events. Lipid abnormalities, again, is a major risk factor for developing heart blockages. There is, I can speak a lot about things. There are a lot of controversies, and my previous speaker also saying the cholesterol is such a controversial topic. Many of us, we don't know what is cholesterol, because we all understand that cholesterol is very important. Each and every cell of our body is made up of cholesterol. So just reducing the cholesterol to very low levels is also not an answer. So definitely, but what we know is that there are 3 types of cholesterol that we have. That is a high, that is LDL, HDL, and triglycerides. The LDL and triglycerides are risk factors for developing coronary artery disease. HDL is called as a protective cholesterol. There's a good cholesterol that prevents any coronary artery disease. So one should check their lipid profile and take their medications or various lifestyle measures to reduce cholesterol levels to prevent cardiac events. And then there is a concept of lipoprotein A, which my senior colleague will be talking more maybe tomorrow. The lipoprotein A is more genetic related. So if someone is having a very high lipoprotein A, they are genetically more prone for developing coronary artery disease. This concept has recently gained a lot of importance, because a lot of young people have been shown to have a high lipoprotein A who has a sudden cardiac arrest or sudden cardiac death. So till now, we don't have very effective medicine targeting this lipoprotein A, but a lot of studies are being done to counteract these deleterious effects of lipoprotein A. Then no doubt we all know that the smoking is injurious, and it has been a warning sign in all the cigarette packets and whatever so. But one should understand that not only smoking, tobacco use in other forms, whether it's a chewable tobacco, they are equally harmful as far as coronary artery disease is concerned. The degree of cancers varies because of smoking causes lung cancers, the tobacco chewing causes mouth cancers, but coronary artery disease is equally bad, equally affected by both smoking and smokeless tobacco. And the risk for death from heart attack almost increased 2 to 4 times. The smoking has very different, it has an additive effect to other risk factors. That means a patient who is a diabetic, he has a 2 to 3-fold increase in heart attack. And the person who smokes also 15 to cigarettes, he also have an increase to 2 to 3 times. But the person who is a diabetic and he smokes, his risk for developing heart attack increased to 9 to 10 times. It is just not 2 plus 2, it is definitely much more. So smoking not only causes heart attack, it also potentiates the deleterious effects of all the other risk factors. And sudden death, again, is very much strongly associated with smoking. So people, a lot of people dying, they have been having tobacco abuse. So they are also very high risk for developing sudden death before reaching to the hospital. The other risk factors that we have been talking, and this is definitely a lifestyle disorder, which is a physical inactivity and obesity. Most of the time they are clubbed together because one leads to other. It's a vicious cycle. So more the physical inactivity, more will be the obesity, and more the obesity, more likely, less likely the patient will go for any exercise. So physical inactivity and obesity also have an important role, and they also is an important cause for developing of these blockages and heart attacks. This is one of the studies that has been done. You can see the various graphs. The upper one is the one person with a morbid obesity, obesity more than BMI more than 35. The risk for developing death due to heart attack is almost 3 times, 3 to 4 times as compared to a person who is a normal weight. Even slight obesity, that is a BMI more than 30. In India, we consider obesity when the BMI is more than 27.5. But in Western literature, because this is a Western study, so in Western literature it is more than 30, they have an increased risk of almost 60% as compared to patient who is normal weight. Even overweight, the person who has a BMI more than 25, that is, many of us will be included, including me as considered as overweight. We are also vulnerable to develop coronary artery disease, and the risk is almost 20% more than a person with a normal weight person. So all these things, what I have been seeing is our data that we have who are more vulnerable to develop heart attack, how much we can reduce all these things by various measures. We will be discussing more and more as the conference continue. So overall, what we have is a modified risk factors. On the left side, you can see diabetes, hypertension, lipid abnormalities, smoking, tobacco abuse, physical inactivity, obesity, and lack of fruits and vegetables. That is also included. So these all 9 is causing, risk factors causes almost 90% of the coronary artery disease, blockages, heart attacks. And if we control them, we can definitely reduce to some extent of developing coronary artery disease. But then there are non-modifiable risk factors, that genetics. We cannot change our genetics. A lot of studies are going on, but we cannot change our genetics at the present situations. Age is a very important factor. As the age progresses, obviously we cannot change it, so the likelihood of developing heart attacks are more. Male gender is again more vulnerable, but it is only up to the age of 45, 50. In the premenopausal women, they are somewhat protected because of the hormones, but at this age, the women are more protected for the heart attacks, but beyond the age of 50 is almost same. That is again a myth that the women have lesser chances of heart attack. That is absolutely wrong, but that is only up to the age of 50. Beyond that, the risk is male and female are almost same. And the last and most important is the stress factors that we don't consider in our medical fields, especially because stress is a very important thing which will modify all the other risk factors. It will increase the risk of diabetes, hypertension, physical inactivity, obesities. They also indulge in tobacco abuse and all these things. But this all can be lead because of the stress. Stress in itself can cause a lot of coronary artery disease. The problem with stress is it cannot be measured. We don't have a data, we don't have a value. Okay, your stress is 40%, your stress is 30%. We don't have any tool or detection way to know. Qualitatively, we can understand. We can ask some questions and we can understand the patient is stressed. But how much is he stressed and how much is likely to develop coronary artery disease, that is not known. But definitely stress is a very important factor in developing coronary artery disease, and definitely a lot of physical measures, meditations, and definitely going to help in many of these patients. Coming back, how we know that a patient is having a heart attack, the classical symptoms are like chest pain, pressures, they feel of pressures on the chest, pain sometimes spread to arm, either of the arms or both the arms, jaw, neck, or back. These are the patient which patient classically presents as a heart attack. Then if it is also associated with shortness of breath or sweating, then chances of likelihood of patient suffering from a heart attack is higher. Some patients may have nausea, some have dizziness, lightheadedness, but these are the classical symptoms which is may be present in around 50% of the patients, but rest of the 50% will have vague symptoms which we need to identify. Symptoms definitely vary in patients who are elderly, who are diabetic, and in women. So that's why this group of patients are sometimes neglected in our clinical practice. One important mimicker that many people is a panic attack, where a lot of females are quite open to this panic attack when they have a sharp stabbing pain in the chest and they feel that is a heart attack. The sharp stabbing pain is less likely to cause a reason for the heart attack. Something so choking in the sensation. The pain is more localized, tremors, numbness, tingling, and if you take a proper history, they may have a recent stressful events. So these are the patients who are more likely to have a panic attack than the heart attack. But even in these conditions, if you are not able to differentiate whether it's a panic attack or heart attack clinically, always visit an emergency room, get an ECG done. I say whenever you have any doubt of the patient suffering from heart attack, first thing is just go to the nearest hospital or clinic, get an ECG done. If the ECG is normal, then at least you are sure that it is not a major heart attack. It may be a minor attack which we can get from blood test or serial ECGs. Similarly, one important aspect is the acidity. What we have in a lot of gastroesophageal reflux disease, where the acid in the stomach, they regurgitate into the food pipe and cause burn. This is also called as heartburn. So heart attack and heartburn is sometimes very difficult to differentiate. So in a case of GERD, it is more like a burning sensation in the chest, which may radiate to the back. Sometimes the patient have a sour taste in the mouth, nausea, and if you take the history, there is a history of speaking spicy food or alcohol in the previous night and they got all this pain. It may occur at rest. It may also occur during the time of sleep. If the patient gets middle of the night at 2 o'clock and he gets all this burning sensation, they are more likely for GRD. And heart attack occurs mostly when the patient is in activity or soon after getting from the bed. So these are the ways we can differentiate. Again, I'll say that even if you are unable to know whether it is GRD or whether it's a heart attack, always visit an emergency room and get an ECG done. And then there is a concept of silent heart attacks. Some people are unaware that they are having heart attacks. So this very vague symptoms like uneasiness and all these things will be there. And they go for a routine investigations. The ECG is done and echo is done. And they have been told that, okay, you are having a heart attack. So these are the patients who had silent attacks in the night. These are more patients in the diabetic, elderly, or in women where we get all these patients. So what does the silent heart attacks? They weakens the heart, and if the patient is not diagnosed in the proper time, the whole heart may be so weak that he starts having features of heart failure. So whenever possible, do not ignore this unusual tiredness or discomfort. Whenever you have symptoms, better to get a checkup done, at least get an ECG done. We'll get a lot of information. So as a medical science, that has been sometimes criticized that the medical science is taking a lot of medications and all these things. These are the data that I want to highlight. You can see this is the graph where the patients die because of heart attacks. In the early 60s, the patients who have a heart attack, the chances of dying was almost 30 to 40%. And with the medical, what are the medical science, whatever the innovations and has been done, we can see that the graph has gradually come down. And presently, with whether it's a thrombolytic therapy, as Anand sir said, immediate coronary angioplasties, various drugs that has come into the market, the death from coronary artery disease in the hospital has reduced from 35% to 6%. And this is purely because of the allopathic medicines. We are not using any Ayurvedic medicines. So this is what the medical science has done. Obviously, this is only when the patients have developed a heart attack and coronary artery disease. How to prevent? Obviously, there are various methods, but medical science definitely has proven itself in bringing this death due to heart attacks from 35% to almost 6 to 7%. So that is very importance of medical science in today's life. So together, this is my last concluding slide. Together for a healthy heart, heart health is always in your hand. You know how is your heart behaving, what you should be doing it. Awareness of all these risk factors, of all the lifestyle measures will definitely prevent heart attacks. And very small lifestyle changes are very important. If you start doing your lifestyle changes, obviously you will be more motivated and start doing better. You may do more meditations, more exercise, better healthy foods, and that will definitely make a long way in preventing heart attacks. Regular checkups, that is very important, that even if the age of 50s or 60s, you should know what are your numbers. So what is your weight, what is your cholesterol, what is your sugar levels, what is your blood pressures. If you know your numbers well, you know what is to be controlled, and if you control all those risk factors, definitely you can reduce your heart attack to a significant effect. And knowing the signs of all heart attacks are very important. You should definitely act fast if you are suspecting a heart attack. So don't wait for something like, okay, we'll give some Digene, let us see what is in the Digene. Okay, send someone to get an aspirin because you know that the aspirin reduces the heart attack. Nothing. If you're feeling that a patient is having a heart attack, just rush him to the hospital, get an ECG done, and let the doctors do what they want to do it. If you have an aspirin along with you, in the way, you can always take it. That will also help you. So let us all work together for the healthy heart. Thank you very much for your hearing. Any questions will be, we'll take up in the next.
Thank you, Dr. Saha. Dr. P.V. Ram Mohan will now brief us on the role of stress in the cause and management of heart diseases. After 23 distinguished years in the Indian Army, including vital roles in UN contingents in Congo and Botswana, and commanding a 400-bedded army hospital, he transitioned his unwavering dedication to compassionate care. Since 2021, Dr. Ram Mohan has brought his invaluable expertise to the diabetic OPD at Sri Madhusudan Sai Institute of Medical Sciences and Research, continuing his mission to serve humanity. Dr. Ram Mohan, please.
Om Sri Sai Ram. Offering my humble pranams at the lotus feet of our beloved Sadguru. Ladies and gentlemen, thank you for gathering here today. Today we will be talking about the most important topic, stress. So all my three previous speakers have stressed on this topic of stress. So you can imagine the gravity of the importance of stress in our lives. So stress is a universal experience. Everybody in this world is experiencing stress. My teenager daughter says, I am under stress. So when I was a teenager, I never heard about stress. This is a buzzword now. So it is an intangible force that can change and at times dictate our lives. So yet, despite its pervasive nature, stress is something we can manage effectively with the right tools and proper understanding. This one? Yeah. So, stress is a part of life, but understanding it is the key. We should know what are the signs and symptoms of stress. Whether you are you're stressed out or not, you should know the signs. So it affects, and this presentation will dive into the nature of stress and its effects on our body. So you can see this picture. So when you have stress, you feel the big rock on your head and neck. So it's a natural reaction to challenging situations. So, and it can trigger physical, emotional, and psychological reactions in your body. So understanding what stress is helps us recognize its presence in our lives. So how many types of stress are there? Acute stress and chronic stress. Acute stress is which is there for a brief moment of time and it is related to some event in your life. But it doesn't cause any problems. But a chronic stress, it can last for some days and it can affect your health. So there are so many factors which can cause stress. There can be internal factors like ill health or some anxiety, some tension, uh, and it can be external factors like some interpersonal relationships, maybe some work stress. So identifying these triggers is crucial in managing stress. So there can be three types of effects like physical, emotional, and psychological. So what are the physical effects? You can feel headaches, you can feel some tension in your neck, and you can have some digestive issues. So being aware of the symptoms helps in managing the stress. On an emotional level, stress can lead to anxiety, depression, inability, irritability, and mood swings. Recognizing the signs can prompt timely intervention and support. So what are the behavioral changes? The person will not socialize. He starts yelling at others. He will have quarrels for petty issues. Then he will exhibit more nervous behaviors like nail biting, fidgeting, and he will not go out. He will not do any exercise. So how to tackle this? Most important the problem in our lives. So mindfulness and meditation. And so practicing, what is mindfulness? It's living in present. Forget about future. So that is mindfulness. They can significantly reduce the stress. These techniques promote relaxation and help in centering thoughts, enabling individuals to deal more effectively with stressors. So of course, physical activities. What happens when you are under stress? Two hormones are released. One is cortisol, the other one is adrenaline. They will cause you to react to the situation. Either you run away from the situation, or you tackle the situation, or you just stay there and freeze. Let the time take its course. This is called fight, flight, or freeze situation. So the hormones play the crucial role here. So when you are doing physical activities, your body produces feel-good hormones called endorphins. So that will nullify these bad hormones. So most important thing these days, time management tips. So plan your day accordingly. Plan your day. Break it into 3, 4, if you have some many tasks to be done in a day. So break them, and you tackle each task independently and finish it off. Then your stress levels will come down. Techniques like setting clear goals and using planners can help achieve this. So seek social support. So discuss your problems with your parents, your friends. You may get some support. So sharing your burden will decrease your burden. If nothing works, go to a counselor and seek help. And finally, you can go to a doctor, psychologist or psychiatrist. They will help you. So managing stress effectively involves a combination of understanding and healthy practices. By addressing stress mindfully, staying active, and finding joy in laughter, we can enhance our resilience and improve our well-being. So this is a Sanskrit phrase, Santosha Paramam Sukham. It means contentment is the ultimate happiness. So be content with what you have. Don't compare yourselves. And that gives you eternal happiness. Thank you. But no, stop. I am not finished. Now, I would like to ask the audience, on a scale of 1 to 10, what, what is your stress? It's 1, 2, 5, 10, how much? It may be 6, it may be 7, but I'll show you of next slide. So these are the Indian Army soldiers. You know where? Siachen Glacier. This is the highest battlefield in the world. And the average temperature there is around minus 55 degrees centigrade, and it can go up to 70 during peak winters. I'll tell you how they reach there. And you are hearing this from a horse's mouth. I was there for 3 months. A soldier is sent there for 3 months. Before they are inducted into that height, it is at 18,000 feet. For 3 weeks, they have to do acclimatization. After they deem that they have to do deacclimatization for 3 weeks. It's like somebody going to space. Before they go to space, they train. After coming back from space, again they have to get used to the gravity. It is something like that. So they live in tents, no electricity, no internet, no TV, no entertainment. What they eat? The food is airdropped once a week by a hepta. It drops the food. Everything is frozen. As soon as it is dropped, within next 10 minutes, it gets frozen. So they take these food items. They have to break each and everything. If there are potatoes, they cannot boil. There is no water there. What they do is they melt the ice. They take in the buckets. They heat the water. A full bucket will give you this much water, and it is muddy. So they have to boil the potatoes. First, they have to break the potatoes. You cannot cut the potatoes. So they will break the potatoes and put it in the water, boil it, and eat it. Everything is frozen. What they eat those 3 months is just dry fruits, some chocolates. Fresh food is not available. So even the rifles, the weapons they use, they don't work properly there. And so the soldiers are there for 3 months. Now, after seeing this slide, tell me what is your stress compared to their stress? It's nothing, it's minuscule. So don't complain about stress. Stress has become a buzzword, it has become a fad. Everybody says, I'm stressed out. Nothing in front of those guys. Thank you for patient listening. Thank you.
Thank you, Dr. Ram Mohan. I now invite on stage Dr. Anand Agarwal to kindly felicitate this morning's speakers. First, to Dr. Annarao Kulkarni, please. To Dr. Deepak Saha. And finally, to Dr. Ram Mohan. I invite them back on stage for a group photograph, please, before we conclude. Thank you. We will have the inaugural session shortly.